Okay.
Good evening, afternoon. I don't even know what time it is.
There she is, Sharice. Hello.
Hello.
Hi.
Yeah,
Welcome.
Oh. Hi. Oh. So that wasn't Dr. Sharice that came on. That was someone else that came on.
Yep. This is Dr. Hamlin. Hi.
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 Hello, doctor.
Hi
Will
there.
this be recorded?
Yes, I'm recording it right now. So great first question. All right. So welcome to the Patients Are Waiting COVID vaccine information session. I'm Dr. Hamblin. I am the founder of Patients Are Waiting. I have a couple of friends and colleagues here who are Patients Are Waiting members, volunteers, and other physicians of color who are here to help answer questions. The format, it's not going to be a very formal event, but I'm going to give some basic ground information about the COVID vaccine. This is meant to answer questions and kind of give a good understanding of what the vaccination is, what it entails, and what it's meant to do. And then our other, Dr. Livingston, Dr. Powell, will also add input about the state of COVID vaccination in our community and what we should all be kind of listening to, looking out for. So if everybody could put themselves on mute here at the beginning, and then I'll let everyone know when we're gonna open up for questions. Okay. So COVID-19 vaccination, we all know what COVID is and that we've been struggling with this for almost a year, for over a year actually. COVID vaccination was first rolled out among healthcare providers or for healthcare providers. So the basics of the COVID vaccine, it's a messenger RNA vaccine. So every single protein in our body is made up off of a transcript or a blueprint. So the vaccine itself is not any part of COVID virus. It is a message or the recipe to make the protein for the spike portion of the COVID molecule. So the message is given into your arm, your own cells take it up, and this part of our cells that make proteins, with like the protein factory, is called the ribosome. So that message is taken in when we produce the spike protein. When you produce the spike protein, your body's immune system recognizes that this is foreign, it's not a part of me, and so now I have an immune response to that. 3 weeks later for Pfizer or 4 weeks later for Moderna, when you get the second dose, you get that message, your body makes the spike protein, and your immune system goes into overdrive to fight it off because it recognizes it already. If you think to when you had chicken pox and then you were then immune because the next time you saw it, you had the ability to mount a significant response. Or with our children, if you give them their vaccine series and their second dose of something like the MMR, usually they have more of a response and they may feel achy or have slight fevers for a day or two after. Same idea with the COVID vaccine. So I'm going to turn it over. Dr. Livingston, if you'd like to add some things about where we are, I appreciate that. And if you look through the pictures of everyone who's here, Dr. Faison is also with us. And he is another physician of color right here in Lancaster. And we're so happy to have him on our team and with us in the volunteer effort to get our community taken care of and safe.
Thanks, Sharice. Sharice is just an amazing influencer, is what I call her, as our founder. I'm Dr. Cherie Livingston. I'm OBGYN department chair at UPMC Lidditz, and I've been an organizer and board member for Patients Are Waiting for nearly 2 years, and I'm honored to sit alongside Dr. Hamblin. I'm not being rude by sitting in bed, but I actually had 3 hysterectomies today and my feet hurt. So please just be mindful. I had to put my feet up. Honestly, I'm not being disrespectful, but standing up doing 3 hysterectomies is a lot. I stand alongside giants. As far as the vaccines, I'll try to hone in on just like the adverse side effects, because that's one of the things that I constantly get asked, since I'm not, what they call like the front line. When Dr. Powell speaks, she's definitely more front line than any of us as OBGYNs. We're learning lots about the vaccine, but we don't, fortunately in our world, we don't see a lot of patients with COVID. We see enough, but not obviously more than an ER physician. We have the Pfizer vaccine, we have the Moderna, and soon the Johnson & Johnson. And as far as side effects, you'll get your injection. You might have some tenderness at the site of injection. We'll watch you for 15 minutes. Most of the research shows that if anything significantly adverse will happen, it'll happen in the first 15 minutes. The chance of an anaphylaxis, so anaphylaxis is like when you think of a side effect, it's sort of a graded response, like, oh, just a mild arm tenderness, all the way up to like anaphylaxis where your heart and lungs are essentially trying to shut down. That risk is like 1 in 100,000 to 1 in a million. So let's sort of put this all in perspective. When you think about the number of people who have died from coronavirus, it's about now 1 in 660. 2 weeks ago, they were saying 1 in 1,000, but it's now like 1 in 660 people have died. So you have more of a chance of dying of COVID than you do having a severe adverse reaction like anaphylaxis. And that's why we as the healthcare providers are so excited to see all of you recognizing that statistic, that you're more likely to die. And so by getting the vaccine, you're helping yourself mitigate the risk of getting severe illness. So as far as side effects, 11% of folks have fevers, arm tenderness, fatigue, but essentially it's a very safe virus, and we will be there keeping our eyes on you for the first 15 minutes, ensuring your well-being, and any abnormalities that develop, immediately seek medical attention or talk with your family doctors.
Thanks so much. And so again, a very safe vaccine. I know the 2 V words we keep sometimes don't think, we're not giving you the virus, we're giving you the vaccine. So Dr. Powell, I wondered if you could chime in here about, we all, I'm sure, have had our lives touched by COVID in one way or another. And is there anyone on this call who has not had someone they know die? Anybody? Yeah. And so we all are feeling this, and we're bearing the brunt of it by being underprotected and overexposed. And so I'm so thankful and appreciative, and I want more of our health systems to come through with vaccine right into our communities. Don't just say, oh, it's available and if you can get through. I think some people probably even felt a little bit of a challenge today with trying to sign up. The limited resources, but I'm really thankful that the resources are brought to us. And so Dr. Powell, can you, I'll give the floor over to you.
I just want to add a couple things. Thank you guys for having me tonight. I obviously have been on the front lines of this battle since the beginning. I do want people to know that there are still treatments available for COVID. People think that there are no treatments available. If your providers aren't offering you things, there are things to qualify for: remdesivir, monoclonal antibody. If you're having problems, my emergency department at WellSpan in Lebanon will help you through this process. And I will personally help you through this process, but there are things available if you know someone who currently is dealing with COVID-19. That being said, I've been vaccinated. I've tried to get my whole family on board with getting vaccinated because I really do feel like it's safe. We've probably vaccinated 7,000 people in the WellSpan system, and we've only seen a handful of allergic reactions and 1 or 2 cases of anaphylaxis, which were easily treated. I will tell you that if you have anaphylaxis to something else, please bring your EpiPen to the site. It's always good if you know that you're prone to allergic reactions to be prepared. We will also be prepared on Sunday, but it's always good to bring your own EpiPen if you have one. You can still get vaccinated if you've had COVID-19. I know that's a question that lots of people ask, but as long as you're not currently symptomatic with COVID-19, it's absolutely okay to proceed with virus. Some people worry about not getting the second dose. You can now, the CDC is saying that you can get the second dose up to 4 months later. Things will happen between the first and second dose. And so we've had people in our own health system be as far out as 3 months in between their first and second doses. So please don't not get the first dose, worried about what's going to happen with the second dose. We'd rather have people have some immune response. And then the last thing I'm going to add is to make sure that you take all your regular medicines. There's no reason to cease and desist with your normal patterns of behavior prior to or after vaccine.
Thank you so much, Dr. Powell. I want to bring another point home, or reiterate a point that you made. When we talk about the best of the best, I said to a patient today, I said, sometimes it seems like melanin is a repellent for good things. That has to change, right? And so we already know that there are certain therapies that, if given early on with COVID infection, can decrease the severity of disease and shorten the course of illness. And so can you talk about the monoclonal antibody therapy?
So monoclonal antibody therapy is not a new therapy. They use it for other autoimmune diseases, for certain types of cancer. What it basically is, it's an hour-long infusion that helps your body mount an immune response to whatever the particular monoclonal antibody is designed to mount the immune response to. So for COVID-19, there is a specific monoclonal antibody that early data suggests may be helpful in decreasing the severity of illness and preventing hospitalization. The requirements for it are you have to show up early in the disease process, within the first 10 days actually of starting your symptoms, because that's when it's going to be most effective. After the 10-day window, people still receive the drug. However, the science doesn't always support getting the medicine at that point. So that's one therapy that I think that is not being widely used and has had limited access because no one's really talking about it. And it's hard to access for most healthcare systems. We're on the cutting edge, with me sort of leading it, making sure that people in our communities have access to this drug right at the level of the emergency department.
Thank you. So LGH does have monoclonal antibody therapy. How it's given, I don't know. Dr. Faison, maybe you can, I don't know if you attend the COVID briefings, and so you may have more information. But if we're not talking about it, like, the thing is, one, if you have symptoms, get tested. You can contact your primary care. You can get tested in the CVS and lots of different places, but you want to kind of find out where you can get tested. 2, contact everybody you've been around, which you shouldn't have been around anybody outside of your house, especially not without a mask. But again, those things. And 3, monitor yourself if you are, getting testing, if you're feeling symptomatic, and complain. Now is not the time to sit quiet and suffer, because even between last week when this was being talked about to this week when this vaccine event is happening, our community has had losses. And so this is the time to speak up, complain about everything, and access what's available. So go ahead. Now, are there questions? You can just feel free to come off of mute and ask your questions.
Yes, I have a question from a person who could not be on tonight. She has had COVID. She did not have to be hospitalized, but she had a severe case. She's asking, should she sign up for this vaccine now, or is there a time period that she should go through prior to taking the vaccine? Or as I think it was Dr. Powell said, if you're symptomatic, you shouldn't take it. So I don't know what to tell her. What would you suggest? She's well now, but she had a severe case of the COVID, and she wants to know, should she take the vaccine now?
So I will answer that question. So, without asking her very specific information, it would be helpful for me to know when she was last symptomatic. I will tell you the CDC is recommending, that you wait some period up to 90 days. We have not in the healthcare system, particularly ours and in other areas of the community, felt that you need to wait 90 days. You do need to wait until you're not symptomatic. So if she's still experiencing shortness of breath or cough, it would be not a time to get vaccine, but she should absolutely sign up for vaccine, because your own natural antibodies will wane and the vaccine will give you additional protections that she should have, even if she's had COVID-19.
Other questions? Let's keep them coming.
I have a question. I have a question about the second shot. Most people, I've been listening and following, most people seem to be okay with the first shot. What can we expect after the second shot? And is there anything that you can do before you take your first shot? Is there any special thing that you should eat? Or I know you're not supposed to take any Tylenol or anything, but as we prepare for the first shot. So really that's two questions.
Yeah, those are great questions. So as you prepare for the first shot, the most important thing to do in preparation for the shot is get your appointment. Okay, that's the first thing. Go through your regular day, and and honestly, so it's no preparation needed. You don't need to be fasting. Just come. Wear something that you can pull up your sleeve, take your arm out, pull up your sleeve, because you're not going to be private. This is not the time to wear your best evening gown or something where you got to take your shirt off and be sitting there with your bra, which is, undershirt, all of that. So wear something that accommodates you pulling up your sleeve and sitting socially distanced from your friends and family who are going to be there getting the vaccine with you. That's the best thing to do to prepare. Afterwards, pay attention. If you're feeling a little ill, you're not feeling great, take Tylenol. If you say, hey, you know what? I always feel sore. I don't want to be uncomfortable. Then just take Tylenol or ibuprofen, whatever you normally take for a headache. Okay. And you can take that around the clock for the next day or 2 days. Most people, if you're going to have, those kind of symptoms of soreness in the arm, and this vaccine, we often will tell you to take it with your dominant arm, have it given in your arm, because you're constantly moving that around, and that helps it to just move and not be as sore. So that's what to expect the first day. When you're back for the second dose, most people, again, so just arrive how you normally do. Don't change what you do before, or, like you don't need to hold your medications, etc. And you don't need to take anything in preparation. So the second dose, get to your place, get your second dose. And what I did is I started Tylenol right away, because I don't like to be uncomfortable. If you want to wait until you say, oh, well, I'll see how I feel. What people report with the second dose, some have nothing but pain at the injection site. Others, many, you'll hear people talk about it. Oh man, I had fevers. And if you don't want to be afraid about a temp of 102, then take the Tylenol. Or the same way that we manage our children when we're getting them for their vaccine appointments. They're saying, well, they might feel kind of tired. If you want to plan and prepare, some employers have it worked in where if you're getting COVID vaccine, there are days allowed. And so if you have the ability to plan, these events in our community have been on Sundays. I keep saying Sundays are for saving lives. Yeah. And so if it's, you know that in 4 weeks is going to be the next event, then that will be your second dose. You might say, I got vacation time. I'm going to take off Monday or Tuesday just in case, so I can feel great. If you feel great and you take your Tylenol, you don't even need it, sit around and watch Netflix and enjoy yourself. But, that's how you could plan ahead. I don't think there's anything more than planning with what you wear, giving yourself some grace, and then just kind of riding out the symptoms with what you would take for a headache afterwards to manage those symptoms of uncomfortableness.
Thank you.
Just to piggyback off of what the Dr. Hamblin said, there is some research that shows about 60% of people will actually feel worse after the second injection than the first. And that's actually a good thing. So don't shy away from it. Or if you heard somebody say that, that's your immune system recognizing what happened to it the first time. Remember, this isn't a live virus. This vaccine cannot make you sick. We've taken a little snippet of the vaccine called the spike protein and duplicated it so that your immune system can recognize and, essentially, be ready for exposure if in fact it were to happen, so that your immune system has already produced antibodies to it. So it's actually a good thing if you feel worse after the second injection than the first, because it simply means your immune system is checked and ready to go. You can't get sick from the vaccine. You might have side effects, but you can't get like the mild, moderate, or severe type of infections that would land you in the hospital or even in the intensive care unit. Your immune system just rearing and ready to go if you're having fatigue, fever, malaise, all the things that we commonly see when our body sees something foreign.
These are great questions. Let's keep them coming. You're on mute, Gail.
You're still muted, Gail.
Still muted. If someone else has a question in the interim.
Sister Gail, you are on mute. You're still on mute. So if you can see a little red button there, touch the mute and that'll take you off mute. Still going. Yeah. Well, while she's doing that, I'll just say thank you, doctors, for what you are doing. It's very, very important, and we very much appreciate it. You indicated it is being recorded. So how do we get the recording? I have an individual that is working but did want to view it.
Right after we wrap up, I will, easiest way, I'll put it on YouTube.
Well, thank you. Excellent.
I do have another question. I don't know, my family teases and said I've been just kind of obsessing about it, but no, I like to be knowledgeable. I am still concerned about people who, I don't know if enough study has been done about people who have long-term side effects, like after, say, 4 months later, they still don't have their sense of smell, or, they're still tired, or I'm concerned, we have heart disease in our family. Is there anything about long-term effects on the heart, or is more time needed for that kind of study?
These are great questions. And so I think it's very, very important when we're talking about, so one is COVID itself, right? And so COVID virus and infection has a myriad of symptoms, so many different things it can cause. You hear about that loss of taste and smell, some people with long-term palpitations or other heart things, and we don't know. We don't know what the long-term effects are of COVID. So when people say, well, I'm young, it's mostly mild in young people, I don't have any pre-existing conditions, so I'll be all right, I'll just get my immunity naturally. With a 1 out of a, listen, I wouldn't drive a car if it was 1 out of 1,000 or 1 out of 600 chance that I would die. I wouldn't even drive a car if it was that risky. And so that idea of let me get my natural immunity and run out here in these streets, that to me is like, that's living on the edge. For COVID vaccination, right? COVID vaccination, we know that you may have mild discomfort at the site of the injection, you may have fevers or feel tired. But COVID vaccine is not giving you COVID virus. So you're not going to lose your taste of sense or smell from the vaccine. You are going to no longer have that 1 out of 600 or 1 out of 1,000 chance of dying of this infection from the vaccine. We know that it's 95% effective at preventing you from being hospitalized or dying from COVID if you contract it. So we don't know the long-term effects of COVID, nor do we know the long-term effects of the vaccine. The short-term effects is you're not going to die. So I'll take that.
Yay.
I talk the same to everybody, whether patients or other docs. So that's kind of how I just break it down. And to me, it makes sense. So hopefully that was helpful.
It was. I've been talking to some younger people, and I know they say, well, a lot of times we don't trust the medical system. I was calling different people and talking to people today, some younger ones who are afraid of taking the shot, who want to wait for the Johnson & Johnson one. They kind of want to wait and see, or, you know, I did read that with the Johnson & Johnson shot, that it was tested more for the African one, and it may, you know, it might be better for people of color to wait for that one. Do you have any anything about that, about the Johnson & Johnson?
I'll let one of my colleagues take this because I could go on and on. Like, wait for what? Okay, but anyway, I'll let somebody else take it. Go ahead, Dr. Faison.
The only thing I can say about the Johnson & Johnson one, it has been tested in an environment that is a little bit more austere, meaning that with these new variants, the Johnson & Johnson has shown to be more effective against the new variants. When we first did the testing for the Pfizer and the Moderna, it was done when these variants hasn't popped up. And it was also done when COVID was in its infancy. Now, granted, at the end of the day, you're worried about, if I get the shot, what's my outcome? Right now, even with the variants, what they're saying is that nobody has actually died as a result of getting or had the vaccination and died. That's what they're saying, excluding, you know, those rare anaphylactic reactions, et cetera. And so this new Johnson & Johnson seems to be, it's going to be just as good. And I do like the fact that you're one and done. So it's more convenient for everybody, instead of taking 2 Sundays out their lives, or 2 whatever days of the week, and then worrying about if your second dose is going to get lost or stolen or misplaced. So, but yeah, you're right. It has been shown to be effective against the variants. We're not going to know what's going to happen to patients when they're exposed with the, you know, we start putting this out into society. But the preliminary studies have shown that it works just as well as getting a 2-shot vaccination.
And I'll just add that right now, everybody except healthcare workers have been waiting for the vaccine. So when we're talking about, I'll take this instead of that, it's like, what are your options really though? What's available? So I think it's a little bit, it doesn't make sense to me when we're saying, oh, well, I'll take which one is it? I want the Pfizer or I want the Moderna. You're talking about the same efficacy, you should take what's available. So I think the decision making is, do I want to be vaccinated or not? And in order to get comfortable with the idea of the vaccine, you need to know what it's against. So are you afraid of COVID or not? And then are you comfortable with the vaccine? Like, do you have enough information? Then it is, what is available. Of the available options, which one do I prefer? And so if no options are available, then that's an easy answer. If one option is available, then that should be easy as well. We're waiting now for Johnson & Johnson to get approved. And I think it might be like even this week, and then for it to actually get here. So I think it's important that we're not kind of spending our time that we learned more than ever in 2020 with how much loss we as a community have experienced. That time, you know, they say tomorrow is not promised, you know, but the reality is we have to deal with what's in front of us. And if, you know, a young person or any person says, I want to just get the 1 shot, that's great. please stay in your house and stay with your mask and only associate with the people who live in your house until that time.
I have good news. The Johnson & Johnson vaccination has been approved under emergency use authorization 19 minutes ago. So you guys are one of the
Fantastic.
first to know. But again, like what Dr. Hamblin has alluded to, they only have 3 to 4 million doses. And we don't know when it's going to make it to the community. So right now you have the option of getting vaccinated on Sunday, which is right before you, because we don't have that option. I think maybe in the summer, things will be different once we get enough people vaccinated. You can start being selective. But I think at this point, it's the old fashioned saying, like a bird in the hand is better than two in the bush. And what we have on Sunday is a bird in the hand. This Johnson & Johnson is part of that. It's in the sky right now.
Thank you. I do appreciate it. I did sign up to take the vaccine, but I'm just getting that feedback from some young people, and I just like to try to educate people as much as I can. So, thank you.
Great questions. There's one in the chat about, does Pfizer help prevent spread as well? So what we know with the amount of time, and I'll just do some, so in general, clinical trials may need about 10,000 people to do a trial and say, is it effective, is it safe? The trials for Pfizer and Moderna vaccine had 40,000 people. In general, you can have, in these trials, you may have maybe 5% of the participants in these trials will be Black people. Pfizer and Moderna trials for this vaccine had 10% of the participants were African American or Black. And so there was a concerted effort to make sure that we were included in the testing so that, because this is affecting the world. And so those things were done. Because of the pressing nature of everything, the outcomes that were looked at, the primary outcomes were preventing death and preventing severe illness. And so that's what we know, and that's what we have the longest time of looking at. There may be later information that says that it actually will prevent it from spread, but we don't know that yet. Okay. Looks like Lily, you got your hand up. You have a question?
Yes. How do I register for the shot on Sunday?
The Brightside Church. So this Sunday event is being done with Brightside Church. I don't want to say the wrong, Brightside Church. And so it was put in conjunction with the community health department at Lancaster General, and Patients Are Waiting. So all the doctors that you see are part of Patients Are Waiting, which is a nonprofit dedicated to eliminating health disparities by increasing diversity in medicine. And so the church posted the link. I believe that it's maybe Karen, or do you know, can you see what the status is now?
All the spots are full.
Oh, no.
We're in the wait list time
Okay.
now.
All right.
Yes.
I just found out about it today because I live at the YWCA. And somebody told me about it today. My director did.
Well, Lily, I know that the YWCA, we're looking at all of these things. And as far as when I say we, I mean Patients Are Waiting, and we're communicating and trying to bring the vaccine to where the people reside. Okay. And so I know that from the YWCA, there's 43 people at the YWCA that we want to get vaccinated. So don't feel discouraged, or don't be discouraged.
F-U-L-T-I. Okay.
Okay.
Thank you.
You're
So
welcome.
it will happen eventually. That's what they keep saying.
And what we're doing is we're trying to make that eventually be sooner. And so this is the second community partnership event that we had last week. We worked with LEMSA, Lancaster EMS, and Faith Tabernacle Transformation and Development Church. And so keep on, Dr. Livingston's with UPMC. We'll work with whatever health system they're bringing the vaccine, and we want to make sure that the community is ready for it so that we can have dispel this idea of, that there's so much hesitancy. I think we all want to live. So we may be hesitant, and that's rightfully so. That is rightfully so, because the concerns that people of color have about healthcare system, they're valid. And so we want to make sure that it's met with information and access.
Okay. And I would be more apt to trust Pfizer and Moderna over Johnson & Johnson. My sister-in-law used Johnson's baby powder for years. She died from ovarian cancer because Johnson's baby powder had talc in it, and they didn't tell anyone. So I don't really trust Johnson & Johnson. I'll be happy with Moderna or Pfizer or even AstraZeneca, I hear. So, yeah.
All right.
But whatever I can get, I guess I want to get, because I'm 67 and I live with a bunch of smokers who don't wear masks. So.
Well, you wear your
we'll
mask
put our
and
web,
stay
we'll,
safe.
we'll put our patients are waiting website in the chat, and you can just continue to follow us on our social media. And as Dr. Hamblin stated, I have been in constant communication with the administration at UPMC so that we can get UPMC to also get 500 plus vaccines available for the Lancaster community. And I think somebody had a question about cost. The vaccine is no cost. It's free at current.
Thank you.
So there's a question in the chat about vaccine being available for people with MS. So let's talk about 1A. Category 1A, we're in Pennsylvania. Category 1A means if you are 65 and over, if you're a healthcare worker, if you are 16 or older with a chronic disease or health condition that puts you at high risk. So if you were to get COVID, if you've looked at this yourself in the last year and said, man, if I get COVID, I'm a goner. You're in 1A, okay? If you're a smoker, you're in 1A. If you're obese, you're in 1A. Not if you think you're fat. If you go online and do a BMI calculator and say for your height, your weight, does that say that your BMI is over 30? You're 1A. Now is the time to exert your privilege of being in the category 1A. So it is not for only people at 65 years old, okay? Other questions?
And keep in mind, pregnancy is now a criteria for category 1A. If you're pregnant, you're moved into 1A. So if you know anybody who's pregnant, who maybe is a healthcare worker or just pregnant with risk factors, then maybe encourage them to get the vaccine. Because we do know if you're pregnant and you get COVID, you're actually more likely to be hospitalized. And if you're pregnant and you get COVID and you're in the hospital, you're more likely to end up in the intensive care unit. So if you know anyone who is pregnant, they are a candidate for 1A status, which makes them a candidate for the vaccine. And also lactating moms, breastfeeding moms.
Other questions?
I don't have a question, but a comment. This is Ted Darkus. As I said, Dr. Hamlin, that Brightside Opportunity Center, the Brightside Baptist Church is a place where we have community awareness. And we always say, if we have something, they will come. And even with the 500, we could have done more and still they would come. And I'm a firm believer that's the right place to have it. And I know people are going to benefit from it. And if they can have it again, they'll still come. So I appreciate everything that you have done and all those that was part of it from the LGH Health Campus, as well as Dr. Powell. This young lady I knew since she was a little girl. So I want to commend her for the great work that she's doing and all the other ones.
Thank you so much, Mr. Darkus, Brother Darkus. So I had mentioned, one of the questions, so I'll just throw it out there. When is it happening again? I wish I could tell you, I was in the office with Dr. Faison, and this has been a big point of distraction because it's so important. And yes, seeing patients and doing your job is important, but you know what? These are lives. We have all lost people, and it's too much. So I know we're all tired of being in this state that we're in. And so I think just the take home point is, when there's an opportunity, don't say, oh, well, I'm not sure if it's me, and maybe no. Think and assume privilege. Assume privilege from here on and forth, moving forward, that if there's something good, it is for you. And let somebody tell you that it's not, rather than assuming the other way, okay? Because you're valuable and you're needed. And you think about the community members that we've lost, no one was expendable. I attended an event last night with our team, a lecture at Millersville, and the lecturer explained how there is nothing new about this pandemic, because the same language, the same things, how it all occurred, it's like almost the same things happen, where the people who are most at risk or who miss the opportunities and the treatments tend to look like us in this community. And we need our communities to be strong. We need each other. And so even this distancing and not being able to get together, whether through church or with families, it's causing harm. And we need to protect ourselves and protect each other. And a vaccine is one of those ways. Assuming privilege and looking for the latest and greatest with technology and with therapies is another way. Making sure that we're advocating for ourselves and our family members. If you feel like you're not being heard, if you are gasping for breath in an emergency room, you don't leave. You say what you need. And you ask questions to make sure that you understand what's going on, what the options are, what is available, because we need each other, and we're all adding something very significant, and we're not expendable.
Excellent. One other question, Dr. Hamlin. Thank you again. At the beginning, you indicated 1 in 600 or so have died. Is that a U.S. statistic or world statistic? And number two, the numbers that you gave for those that had severe reactions, that was 1 in.
It's Dr. Livingston. I can speak on those statistics. So to date, I think it was earlier in this week, President Joe Biden and his team really just paused. The nation paused as we crossed over into 500,000. It was a horrible mile marker. If you take the number of Americans, so to answer your question, that is a U.S. statistic. Okay. It's a painful U.S. statistic, but based on the number of people who live in the U.S. and 500,000 deaths, that's 1 in 663 people. That is scary. And when you score that against the risk of having a severe adverse reaction, to date, it's about 1 in 100,000 to 1 in a million. And so when you're talking to family, you say, you don't have to be a statistician to know which number is worse. My chance of dying, 1 in 663, versus my chance of having an anaphylactic reaction, which is just, a really bad reaction, is 1 in 100,000 to 1 in a million. And so when you, as I can tell by your head shake, you totally get it. You focus on the thing that's more likely to happen. Like, so we encourage people to get the vaccine so that they can decrease their risk of developing severe illness. Because if you develop severe illness, you're more likely to end up on life support and unfortunately succumb to your illness.
Excellent. Thank you so much. The reason for asking, we certainly can't recap all that you're giving here now, but I expect on Sunday morning in our worship service, I like statistics, and that's one that I might quote just as a quick recap of the severity of this situation. So thank you.
Absolutely.
I know we're here to sort of answer your questions, but I just would like to ask a question of the group. Has anyone who's listening to this information had the vaccine and is willing to give a testimony? It's easy for us as physicians to sit here and say, please do this, but I think it's helpful if you hear from your peers that this is okay. They've been through this, they've done it, and it's all good.
Yeah, I'll raise my hand again, and I don't want to talk too much, but yes, my wife and I did have it. February 6th was our first doses. We had the Moderna, and I had a slightly sore arm for 2, maybe 3 days, just slightly sore, not bad at all. And I don't think my wife had that even. So other than that, I've had no effect, none whatsoever.
Okay, I had the vaccine also. I got it last Sunday over at Faith Tabernacle. And my arm was a little sore in the muscle there. Not enough to even speak of. I mean, I could feel it, but it was nothing to speak of. The night, 2 nights afterwards, while I was sleeping, I felt some body aches. But again, nothing enough to make me even want to take any medication for it. So, and you know, those are things that we were told could happen. And when you think about what happens with the COVID, these things are nothing. So yeah, I haven't heard anyone have any really bad side effects or allergies.
Wonderful. Yeah. Any other, for me, so I did mine back in December. And December, yeah, it was December. So the first shot, I didn't, it was fine. I went live on Instagram and was talking about it. And when I got home, that was the same day that when I got home, the thing that pushed me over the edge to sign up, because I hesitated at first, I was like, man, let some other people go first. Let me see if the CEOs, every picture I saw was either Dr. Livingston or some other Black physician or, some other healthcare worker. And they're like on the front page of everything getting this vaccine. And I was like, show me the CEOs getting it. Right. So I was looking, I'm like, I follow what the country club folks are doing and we'll see. So I wasn't seeing that because somebody had given the memo that, hey, you got to show the Black people getting the vaccine. And so everyone was doing that. And so I was kind of hesitant. And then I thought about, my family members, and I've had, my aunt died earlier last year from COVID by herself in Brooklyn. And, and it was, awful. But I kind of felt like I can't waste this opportunity when I'm here now in this preferred group. And the day that I got my vaccine, I came home to news about a friend from high school who's 2 years older than me dying that morning in intensive care. And so I didn't feel anything from the shot. I just felt angry, very, very angry that I lost my friend in a way that I felt like at 42, he shouldn't have died. And so the week after the vaccine, I spent corralling my other high school classmates just to get together and kind of remember, and having a Zoom get together, reminiscing about all of our good times. And I attended a Zoom funeral, and I never want to do that again. So my second dose of vaccine 3 weeks later, because I had the Pfizer, that was what was available that day from when, the sign up, I just felt relief. That was the most side effect I had. I took Tylenol for 24 hours after because I don't like to be uncomfortable. But the biggest thing I felt was relief.
Amen.
Are there other questions or comments or things that we can address I put in the
Yes,
chat.
I suffer with asthma. And I was wondering if this would kind of, hurt me more, by taking this, because I do suffer with asthma.
So being asthmatic, that makes you at high risk of COVID. And so I'm happy that you are here now, which means that you've been spared through this. But I think that that's an important disease or an important reason to protect yourself from COVID. Any other? I find a recurring theme is that people who have high risk conditions are worried that their condition will make them not tolerate the vaccine. And I'm like, again, if we go through the decision tree of how concerned are you that if you contract COVID that you will die or have a severe illness, and then that says, okay, well then that should dictate how you manage your life, whether that means that you're home, that you wear a mask, that you are avoiding unnecessary exposures, and then how much do you want to or need to protect yourself, and then how concerned are you about side effects of the vaccine. So and Dr. Powell, it looks like you were going to say something else.
Yes, and of all the allergic reactions I've treated to this vaccine, none of them have been wheezing. So, and this has been in asthmatics and smokers and people with COPD. The bulk of the allergic reactions we've seen have been elevated blood pressure and dizziness, fever, site reactions, but we haven't seen a whole lot of, we've had one anaphylaxis reaction, and the person had recently had COVID. And so that's why we think their response to the vaccine was what it was. So I wouldn't worry about your asthma getting worse by just getting the dose of the vaccine. And
we also have with us tonight.
Oops, I'm sorry.
Sorry, Erica. Oh, no, I was also going to say we have Dr. Andrea Stern from Harrisburg with us. She's a family physician. Dr. Stern, anything you want to add from like a family doctor standpoint to help the community here? And we're so grateful you're on tonight as well.
Thank you. I got on to be nosy, honestly. I like information. And I'm sorry I'm out of breath. I'm on the treadmill. Okay, so as a family doctor, everything you're saying is spot on about the concerns. I've had patients call me today, even with questions, just wanting to hear from me about, is it safe? I've had mine. I want my family to have it. I want everyone that can get it to get it, because I've seen the ugly of it. I've seen COVID delirium. I've seen renal failure, kidney failure in a 40-year-old requiring dialysis 3 times a week. Heart failure in many cases, arrhythmias, lots of badness that I'd rather not deal with. If it's just a sore arm and a fever and a couple of days of discomfort, give me that. Like, I got kids that can't get the shot. I'm trying to protect them and not bring things home to them. So to me, it was a no-brainer, and I hope it is for you too.
Thanks, Dr. Stern. And you notice she's on the treadmill. It's Friday night. I heard one of my colleagues say something so intelligent. They said the best way to mitigate this illness is to get whatever chronic conditions you have in check. If you have high blood pressure, if you have diabetes, if you are obese, in addition to getting the vaccine, get these chronic conditions under control. And I thought that was really good advice, even for all of us. It's not, we're not, pointing fingers. We're just saying it's important that you approach this very holistically. And remember the 3 W's. So when we get the vaccine, that's helping. When we get our chronic conditions in order, that's helping. But the 3 W's, staying wide, so maintaining social distance, wearing our mask, and washing our hands. Those 3 W's are what we call mitigating factors, because many of us still can carry virus in our nasal tree, in our nose, in our mouth, and our eyes. And so it's important that we understand that the vaccine is designed to help prevent serious illness, but the mitigating factors, the 3 Ws, are designed to prevent infection, spread from one person to another.
And just with that, remember, the people in your house, that's your bubble. So earlier, like 6 months ago, I saw a patient who hadn't seen her daughter or been in the same room with her daughter, who lived in her house because they were trying to, that's not it. So the people in your house, that's your bubble, okay? Now, if someone becomes ill and you're having to quarantine, then that's right, Tracy. You hold on, you hold on. So, we need each other and we need community, we need support. So, at the beginning of all this, I know there were people doing family Zooms every week to kind of check in with each other. We are all Zoomed out. I get it. I hear you. So I have been waiting for this for some time, and all of us are in our health systems. I can't prescribe COVID vaccine for a patient. My office, we don't have it. Dr. Stern, we talked this morning, she doesn't have it either. So, we all are can be feeling somewhat powerless even in healthcare because the vaccine is the thing. So I'm very thankful for Patients Are Waiting as a vehicle to help the community connect with the health systems in ways that even we from inside of healthcare can't do. And so we're just looking for the next health system to come on with it and put up the next pop-up vaccine clinic vaccine event. And I know that more health systems will come on board and do these types of things, bring vaccine to communities of color. And we just need them to do it as fast as possible.
I have a question. Do you know anything about the pop-up that's going to be at Bonton at the Park City Shopping Center in Lancaster?
Dr. Faison, I'll let you take that one.
Yeah. Yes, there will be a pop-up center at the Bonton in Lancaster. We're going to start with 1,000 per day, and then the goal is to ramp up to 7,000 to 8,000 a day. There's the hospital, LGH is going to, this is actually a joint venture, so I'm not going to just say Lancaster General. It's a joint venture, if I'm not mistaken, between UPMC, Penn State, and Lancaster General. I'm not sure about WellSpan's involvement.
And WellSpan, yeah.
And WellSpan, thank you. And so they've already contracted out renting that Bonton space, and they're now in the process of hiring nurses and healthcare providers to be injectors, as well as people needed for observation. So the goal, this is the goal, March 26th to sometime to April 5th. And basically the state of Pennsylvania has arranged with these four hospital systems. Basically they've used in the philosophy, if you build it, we will come. So they want us to have the mass vaccination center built and up first, and then they will give us the large numbers of vaccines we need to start vaccinating patients. I think Pennsylvania made I don't want to call it a mistake, but we made a decision as a state to try to put the vaccines in pharmacies and kind of give it out 200 here, 300 there. And that's why Pennsylvania is 42 out of 50 in terms of vaccinations. So I think the government is saying, you're going to start doing mass vaccinations to get vaccines in arms. And that's the most important thing, get the vaccines in arms.
Thank you.
So if you hear people saying, well, I'll wait for the big site to open up, I think that message should have been loud and clear, is get vaccinated. So one is to make the decision about, do you want to be vaccinated or not? And that decision you're going to make based on your risk and based on your understanding about what the vaccine is. Once you've made that decision, get it as soon as you can.
Dr. Hamlin, can you roll out the more positive side of what to expect once we've been vaccinated? I want to look at going forward. Okay, I've been vaccinated. I haven't, but I want to look at after I'm vaccinated. Right now, I don't see my family like I want to. I feel too isolated. I do all the things that I feel is necessary to keep myself safe. But as we all know, we want to see family. I want to hold my grandkids. I want to be able to hug them at least. So what can you tell me on the positive side? I know we still have the 3 W's to be concerned about. We always have. Wash your hands, but now we have the social distance and all those things. Yes, we still will have to wear a mask. I don't mind that. But what can you tell me I can expect? What type of honeymoon can I expect?
That's a great question. And so the real answer is it doesn't change anything, right? As far as recommendations, et cetera. But, you know, from a logical standpoint, one is you should expect relief, because if every time you go outside, you're thinking, I need to get this one thing from the store, but you're like, no, let me wait until I have nothing left in this house. And because there's a lot of things that we've adjusted to that are not normal, a lot of things. And so your bubble is, you know, who lives in your house. If your people who, you know, if anybody else, like say you have your sister, now she's vaccinated, and you guys say, you know what, we're going to put our 2 bubbles together because now our risk is the same. You see what I'm saying? So those are some of the things you might consider in the future, but it's not like, oh, I got vaccinated, catch me outside. No, that's not it. That's not it.
Well, let me go a little further. My bubble right now is uno, just me, okay? And some of the people, my family, are not considering being vaccinated right away. So are you telling me my grandkids, I still may not want to consider including them in my bubble?
I mean, are they going to move in?
Scientific wise, that's good enough. I just want to hear the science. So what is the answer on that one?
So Miss Ellis, I'm going to give a little different perspective on this, because I am also seeing the downside to people who have been so isolated that bad things are happening to their bodies and their minds. And so we always must balance in life, the science with what we need spiritually and emotionally. So if you need to hug your grandchildren, you double mask, you got your vaccine, you go on and hug your grandchildren, because that's what's real. And that's what I have a little kid who's probably not going to get vaccinated because he's 10 for another year. I need to hug my baby.
That's right.
I mean, and I know that there's some risk with that and understanding what that risk is. But I mean, I went for a couple of months sleeping in a different room, in a different bed, isolated from my husband and my family. I don't want that life. So, I mean, the science will tell you never touch your kids until we're all vaccinated, but that's not, you know, it's been a year now. And if you're protecting yourself and they're wearing a mask and you're wearing a mask, that doesn't mean kiss them on the lips, but you go on and give them a hug. Outside is better, you know, let's just keep it safe.
Absolutely.
But I think it's important to nurture your soul.
Thank you. I think you've helped out a lot. And I get it. It's very clear on the spiritual side, and, you know, using some common sense too. I think that's what we need. Thank you.
Awesome. Are there any other questions?
I am going to just add one last thing. Make sure you check in on the mental health of people. We are not just broken physically by this. Many of our elders, cousins, brothers are broken spiritually. So pray for people, get out there and make phone calls, call up somebody who might have been alone for the last 6 months, because I'm equally seeing enough people die from suicide and from this as well. So it's an equally real impact on our community. So make sure that you're taking care of the mental health piece.
On that note, I'm going to put a link in the chat here. So I did just share the TriStar vaccination job board. TriStar is the company that's doing all the staffing for this site. So for those of you, you know, we've been hit on multiple fronts. We've been hit in the pockets. Some people have lost their jobs or have had too much risk at their job to stay there. And, you know, this is an option. So get yourself vaccinated and then go to work at the site and get your paid, your hazard pay. I mean, these are options and you can share this in the community. Also, I put in the link for the mental health initiative. So patients are waiting. As I said, you know, our organization, our mission is to eliminate health disparities. Now, health disparities are different outcomes for different groups of people. We know that mental health is often ignored in communities of color, and we have a grant program that provides 3 mental health visits by some of your own, by local mental health professionals, including Dr. Latinia Shell, that lots of you know. You can click the link and sign up to get 3 sessions with a mental health provider, and everyone's doing telehealth visits. So whether it is you've been cooped up too long with your spouse, you can't stand him anymore, and now you guys need couples therapy, or whether it's that, you know, you just need somebody to talk to who's paid to listen to you for 3 hours because your best friend's tired, or that you are, you know, even if it's with a physician, if you've been on medications, but if you're not plugged in or you've been thinking about doing some kind of therapy, click the link and just get connected. There's no cost to you with that. We have grant funding for these things. If you have students who are in high school and they are interested in, or, you know, if you're interested in your student going into a healthcare profession, get them to take a look at our AMED program. That link there is the application link. It's a completely free program, again, to get more of our students in healthcare fields. So this is for juniors and seniors. The program will start in March 16th. It's on Tuesday nights from 6 to 8 on Zoom. They will get to interact with healthcare professionals and work with other students from around the country to come up with healthcare solutions and health disparity solutions. They will learn research, design, and they'll be doing an expo. All of this, again, is online. We need to build the healthcare community that we want to see that's out there to take care of our patients. And, you know, I think that Lancaster can produce the next savior of the world. You know, the scientist who came up with the COVID vaccine was Dr. Kizzmekia Corbett, who is a Black woman, 35 years old, from North Carolina. And there's no reason why this community can't produce the next great scientist. And so those links are in the chat. I want to wrap us up, but Amaya Langan, can you close us out and tell this wonderful community who you are and what you do and where you're headed?
Hello, everyone. Good night. Good night. Can you all hear me well? Just a thumbs up. Great. So my name is Amaya Langan. I am originally from Brooklyn, New York. I attended undergrad at Franklin and Marshall College. Can you guys still hear me? Great. I attended undergrad at Franklin and Marshall College. I graduated in 3.5 years, so I just recently graduated. And did I mute?
Yep, we can hear you.
Okay, perfect. I thought you guys were frozen. Sorry. Yes, so 3.5 years, and I now currently work full-time with Patients Awaiting as a director of programs. And I'm also heading on to graduate school. I got into all of my schools that I applied to. My top school was Columbia, so.
Please run the whole list.
Oh, the whole list. Oh, okay. So I got into NYU, I got into George Washington University, Boston University, Brown University, Columbia University, CUNY Graduate School of Public Health, and Emory University. So God's willing, if all things work out, I'll be attending Columbia University in the fall. Super passionate about health equity. If I could wear a banner, I'd wear it every day. Maternal and child health, all of that. So also I did want to plug, if you know any of your family members who are currently pregnant right now, and you would like them to have a support person during their birth, because you know COVID right now, when we're talking about COVID, we're talking about having access to care and support. Please sign up at this link. We are providing free doula services to women of color in Lancaster, making sure they have someone on their team along with our beautiful OBGYNs here, but somebody also there to support them with education and emotional support before and during and after their birth. I hope you all have a great time this Sunday getting vaccinated. Make sure you plug everyone about Patients Are Waiting. We're here to support you and be your advocate. And that's all for tonight. Have a great one.
Thank you. Have a great evening, everyone. Thanks so much. I will get this recording uploaded soon and onto the church website and onto the Patients Are Waiting page. Thank you so much. Have a great evening.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye-bye.
Thank you much.